Understanding Pelvic Inflammatory Disease, PID, in Ghana. A comprehensive overview. Hello everyone. Today we're diving into an often overlooked yet critical health issue that affects many women in Ghana, pelvic inflammatory disease, PID. As a community, it is vital we raise awareness about this condition, its causes, symptoms, and treatment options available. By sharing knowledge, we empower our sisters, daughters, and friends to seek the necessary care and support. What is pelvic inflammatory disease? Pelvic inflammatory disease, PID, is an infection of the female reproductive organs, which includes the uterus, fallopian tubes, and ovaries. It commonly arises from sexually transmitted infections, STIs like chlamydia and gonorrhea, but can also be caused by other infections. If left untreated, PID can lead to severe complications, such as infertility, ectopic pregnancy, and chronic pelvic pain. Understanding the causes. In Ghana, as in many parts of the world, PID is often linked to STIs. While not all women with STIs will develop PID, the risk significantly increases when bacterial infections ascend to the upper reproductive tract. Other factors that may contribute to the risk of PID include 1. Multiple sexual partners. Having multiple sexual partners increases exposure to STIs. 2. Inconsistent condom use. Failure to consistently use condoms can heighten the risk of STIs and subsequently PID. 3. Lack of education. Limited knowledge about sexual health can lead to unsafe practices. 4. Previous reproductive health issues. A history of reproductive health problems may predispose women to PID. Recognizing the symptoms. Early detection is crucial in managing PID effectively. However, symptoms can often be vague or mistaken for other conditions. Common signs include lower abdominal pain, abnormal vaginal discharge, pain during intercourse, fever or chills, irregular menstrual bleeding. Many women with PID may not exhibit symptoms at all, making regular checkups and open conversations with healthcare providers essential for prevention and early detection. Complications of PID. The consequences of untreated PID can be devastating. Some of the potential complications include infertility. Damage to the fallopian tubes and reproductive organs can prevent conception. Ectopic pregnancy. A pregnancy that occurs outside the uterus can be life-threatening. Chronic pelvic pain. Ongoing discomfort can significantly affect a woman's quality of life. Peritonitis. A serious infection of the abdominal cavity that can arise from PID, so treatment and management. If you suspect you have PID, it's crucial to consult a healthcare professional for diagnosis and treatment. PID is usually treated with antibiotics, and it's important for sexual partners to be tested and treated simultaneously to prevent reinfection. In Ghana, healthcare facilities are increasingly equipped to handle reproductive health issues, but there remains a pressing need for public education. Here are a few steps to mitigate the risks and improve outcomes. 1. Regular checkups. Encourage women to schedule routine pelvic examinations and STI screenings. 2. Education on safe practices. Incorporate sexual health education in schools and communities, raising awareness about STIs and their potential consequences. 3. Access to healthcare. Advocate for better access to healthcare services for all women, particularly in rural areas. Empowering women through knowledge. As we continue to build a healthier Ghana, it is vital to foster an environment where women feel empowered to discuss their health openly. It's our responsibility as a community to normalise conversations around women's reproductive health. We encourage you to share this post, engage in discussions, and seek out resources related to PID and broader sexual health. In conclusion, pelvic inflammatory disease is a significant health issue that requires our attention. By educating ourselves and others about its causes, symptoms, and treatments, we can work together to improve women's health in Ghana. Let's create a society where women's health is prioritized, respected, and supported. Together, we can make a difference. This is Health Awareness Series,